Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
Okay, so Dr. Kevin Usry, sorry, I was so excited about your coming in this morning, and I looked in the outside living room there, didn't see you, but you were hiding there. So I'm glad you're here now. Okay, so has it been a good week for you?
Excellent week.
It's always a good week for you, isn't it?
Yes.
You've been doing a lot of good stuff for so long, and I have to say that I talk a lot about you because there are people who do have peripheral neuropathy, and they've kind of given up. Isn't that funny? And I say, why are you giving up? I have somebody that can really help you. Why do they give up?
Well, usually their doctors tell them there's nothing that can be done. Out of the toolbox the medical doctors use, whether it's a podiatrist, a neurologist, your family practitioner, they're all using medication. And it's the same medication no matter who you go to. They're gray market products, meaning the original use for that drug is not what they're using it for. These drugs were developed for seizures and for depression, but they seem to have some effect at reducing the symptoms of burning and tingling and pins and needles for about 30% of the patients. So after that's not effective, the medical doctor really doesn't have much left to offer them. And that's a hard thing for a person to hear, that you have to live with it. And it's just not the case. There are journals replete with information about how you can deal successfully with peripheral neuropathy. And we have that information for anyone who wants to investigate if there are scientific reasons why I'm making these statements. And we'll be more than happy to send them the copies of the journals so that they can look at that information themselves. But it simply is not true that there isn't anything that could be done for peripheral neuropathy. We've been doing it for 20 years.
Okay, so let's just talk about that. How young would someone be who may get this? Is this something that just happens, or is it from whether they had chemotherapy or something else? How does it happen?
How do we get sick? How do you get a heart attack? How do you get cancer? How do you have a stroke? It's a long, steady spiral downward, if you will, in your health. Things like having too much insulin floating around in your body, what they call the metabolic syndrome or syndrome X. As your glucose starts to keep creeping up towards diabetes, your insulin raises. Insulin, when it's too high, stimulates cortisol as well, and those you can consider to be accelerating aging products, meaning those chemicals age us faster than we should be aging, and they suppress DHEA, which our body produces, and this is what helps us with our sexual hormones, estrogen, progesterone, testosterone. So many authorities believe when you're looking to get a biological age on a person, you get their DHEA levels. So in addition to this insulin and sugar issue causing such effect on the blood vessels, it also is leading us down the road towards diabetes and things like peripheral neuropathy.
Now, my dog has Cushing's disease and is being medicated for it. When you talked about cortisol, is that, I think, if I'm not mistaken, has too much something, and I can't remember what causes that, but...
Well, stress, number one, is the biggest cause of excess cortisol. Our adrenal gland produces cortisol. And when you have a disease of the adrenal gland with not enough produced, then you have Cushing's. When too much is produced, you have another condition that affects people.
So. So do you have patients with Cushing's disease?
No, we don't treat disease.
No, I know that you don't. I know, because if someone comes in, you do a complete lab on all their, I guess, everything, what their blood shows. And then how do you deal with it? I know we're talking about peripheral neuropathy, but because you always say that we don't treat disease, what do you treat then?
Well, that's a good question. A lot of people wonder when do I go to the chiropractor? When do I go to the medical doctor? How do I decide? You should start with the most conservative approach. So that would be going to the chiropractor. Most of people's maladies that they deal with on a day-to-day basis that aren't diagnosed as disease are functional problems. Chiropractors are doctors of function. So when you have many of these maladies like headaches, I can't sleep well, I have indigestion, I'm getting sinus infections regularly, those are things that are functional problems, and chiropractors treat those things.
That makes a lot of sense. So, sure, why start on medication when, okay, so let's say someone comes in with this. How do you treat people?
Well, a good treatment starts with a good diagnosis, so you give them a thorough examination. If we see signs of pathology, that's a big red flag to say, all right, well, this is not falling into my category that we treat. We need to refer you over to a medical doctor because it looks like you may have a disease. These symptoms that you've come in with, they look like maybe this is heart disease. So you really need to go see your medical doctor. Let's clear that up. Let's make sure this isn't heart disease. Go to the person who is best qualified to treat that issue, and that would be your cardiologist.
Okay, but let's talk about someone who comes in and let's say they just don't feel well, and I guess you would adjust them. Let's go back to what people think that you go to a chiropractor for adjustments. So why don't you clear that up?
Well, I think that's a reasonable statement. You go to a chiropractor to have your spine adjusted and aligned. That's what's protecting your central nervous system. Your nervous system is that system that controls and maintains all the other systems in the body. Your cardiovascular system, your musculoskeletal system, your eliminative system, your digestive system. We're nothing but a house with a lot of systems in it. And there has to be something that regulates all the systems. We would use, if we had a smart house, we'd say, oh yeah, the computer runs all the services in the home. And we have different departments. There's the electric department, right? And then there's the plumbing and there's the lighting. So it's the same thing with the body. The brain controls all of this, and the lifeline between the brain and the rest of the body is the spinal cord. So you never want to have pressure on the spinal cord because that creates dysfunction in those particular nerves that are being pinched. Where those nerves go to, those particular tissues suffer because now they're not getting that full amount of nerve information from the brain. And almost if you can picture in your mind a rheostat on a light, instead of it brightly burning, it's dull.
This is fabulous. I mean, I thought I had a doctor here. Now I think I have a plumber and an electrician. But
analogies are very important for people to form thoughts where they get a concept.
I agree with you. I'm enjoying this very much that you're talking like that. So people come in there and they may walk out with something completely different from what they thought they had.
Yes. As a rule, people come in, they have something going on. I think from doing this for 33 years, a lot of people think, oh, I hope I don't have cancer. Oh, I hope I don't have some sort of disease. And it's nice to be able to tell them, no, okay, here's where your problems are. They're functional. We can work with those functional problems and over a period of time, bring you back to normal health and normal function. And that's what we do, whether we treat peripheral neuropathy or someone comes in with a shoulder problem or headaches or I can't sleep, the things I just mentioned to you. We just go through a very thorough examination process, and usually we're able to find out why those things are occurring and use nutrients such as herbs or vitamins or homeopathy. And finding the proper treatment for the patient is imperative to get the results you're looking for.
It's interesting. You just must have gotten into my brain before I was about to ask you a question. Do you know that most doctors don't understand vitamins or nutrients or herbs? I am so glad to know that you do. So if someone they have questions about this, they could come to you and you would help them and explain the vitamins they should be taking, the nutrients they should be taking, the herbs. You've really studied that, haven't you?
Oh, yes. Hundreds and hundreds of hours.
And so, years ago, doctors said, forget it. You don't want to take vitamins. You're just going to, they were not high on that. But now it seems to be extremely important, at least in everyone's mind.
Yes, the idea that you're getting everything from your diet, especially the typical American diet, well, it just doesn't occur. You do need to supplement your nutrients through pills. Sorry to say, we definitely want to eat as healthy as we can, but how many of us get 7 servings of fruit and vegetables a day? I mean, it takes a lot of effort to meet those dietary demands, if you will. So having a supplement to fill the holes where you may not have addressed those issues that day is the best way to stay healthy and keep all of the proper nutrition going.
So if I came to your office, do you have a vitamin you would sell me that you feel is great and would cover everything, whether I need it or not? An all-purpose vitamin. Now, I don't even know how you feel about that.
Yeah,
I probably opened up a hornet's nest, didn't I?
A multivitamin and mineral is an excellent idea, and it's a great start. But sometimes there are particular nutrients a person needs. Good example, when we're testing patients, the need for B6 is incredible. We see it so much, especially with the peripheral neuropathy. Much of the people's issues has to do with compression on the blood vessels, constriction on the blood vessels. So if you're carrying extra fluid in your body, then that's a good chance that that extra fluid is putting pressure on those blood vessels and creating a circulation problem. So B6 is kind of the natural diuretic that allows us to get rid of excess fluid.
This is wonderful. I want everyone to know that you're listening to very smart, very nice doctor, Dr. Kevin Usry, and he is located in Lake Park it's north of Palm Beach Gardens, and it's the phone number. Remember, this is Pencil Talk Radio. If you're having some problems and you don't know what to do, don't start on the cannabis right now. I want you to go see Dr. Usry. Let me give you his phone number. It's 561-683-8779. Oh, 862, sorry.
863.
I did say that right.
863.
8779. I did say it. I thought you were shaking your head. Okay. It was 863-8779. 561-863-8779. But go to his website. Very nice website. It's called allamericanwellness.com. allamericanwellness.com. And Usry is USRY. And Dr. Usry is really a pioneer. I've felt that since I've met him. He has been doing things that a lot of physicians are just finding out. Non-medicine, non-surgical, and you can call for a free 15-minute consultation. We really feature every month his article on peripheral neuropathy, and I really didn't understand, why he focuses in on that until I've talked to him. It's something that most doctors don't know what to do about, and it is painful, isn't it, Dr. Usry? I mean, people can't.
It completely changes their life. It takes away their independence, stops them from doing the things that they used to love to do. It really robs people of hope for a good, independent life.
And you said they can't sometimes have to stop driving because their feet don't...
without a doubt. Sometimes they have to stop driving. Many times they need walkers. It's really disruptive for their sleep patterns because a lot of their symptoms become very prominent at night. So it really has an all-encompassing effect on the body. Not to mention, I'm going to use a big word, the effect of improper proprioception, meaning the information coming from the feet going to that special part of our brain called the cerebellum. This lets us know where our body is in any given time. It's critical that the brain knows that, so the body doesn't fall. And this is the outcome of peripheral neuropathy. People start falling, and you fracture a hip, you fracture a hand, something happens in the fall, and it can really be a life changer.
I've written articles and I read articles all the time about falling, and there are all sorts of machines that people are tested about falling. So I want to get back to peripheral neuropathy, though. So if is that's there is something called the restless leg syndrome.
Yes.
Does that have anything to do with neuropathy?
Not really. It's more of a nerve-related
Have you
issue.
helped people with that?
Oh, yeah. Restless leg syndrome is a syndrome. It's not a disease. Many different causes for the irritation to the nerves. It can be mechanical. It can be biochemical. It could be biophysical. So you have to look at those areas when you're dealing with these different kinds of mystery syndromes, and to be able to come up with what's going on in the body. Where did the physiology, where did the function go wrong? Can we return that function back to its original 100%?
Richard Bernstein has just turned into your. We have Dr. Usry on Facebook Live, and if this is Richard Bernstein, who I know, he's probably the finest insurance executive in Palm Beach County. I've known him for many, many years. It's interesting that he's listening. So what you're saying, though, is if someone would just come in and have a visit, and you may find nothing wrong with them, but then you may find one little thing that you can tweak, or you may find a lot of things. They may have peripheral neuropathy and not know that they have it. There may be something else they don't even know.
It's quite
right?
possible. Absolutely. We see people, this is a family practice. We happen to specialize in a couple of areas, one of them peripheral neuropathy, but it's essentially a family practice. So everything that you see in a medical doctor's family practice, you would see in our office.
You get to meet his daughter, who's an acupuncture physician.
Very proud of Dr. Heather Usry.
Right.
You know, she's our acupuncturist. And really the glue of our wellness center. She is just an all-around expert at so many different things that have to do with Eastern medicine. And that is an entirely different approach than I use, than a typical medical doctor would use. So it's a fascinating healthcare therapy that people should all look into, because energy throughout the body is important, and if it gets interrupted, it can create a lot of different problems for
Does she
people.
cook Chinese herbs?
She went to one of the few schools that actually emphasize herbs. Many of the acupuncture schools don't do that, but right here in Fort Lauderdale, Adam, that's the school she went to, they emphasize the use of the herbs. So many times she doesn't even have to use needles.
It's interesting. Well, that's really interesting. I told you before that my stepdaughter lives in Portland, and she went to the Oriental School of Acupuncture. When she comes to visit, I walk into my house, and the herbs are cooking, and they're very powerful.
Oh, very, very much. They're volatile. You can smell them probably from outside the door when you're walking in. You know, they have a strong aroma, but they're very powerful in their therapeutic. They can heal many things that you think would be hopeless.
Give me an example of what your daughter may have done with the herbs, or even with her acupuncture.
We had a woman who came in, and she had a wound that she was getting treated at one of the local hospitals. And they were having a really rough time trying to get this ulcer to heal. My daughter went ahead and did her diagnosis. She takes pulses. She looks at the tongue, and that's where she decides to use her therapeutics based on what she sees from the pulses and from the tongue. And within a week, that wound was already starting to heal. The wetness and the oozing of the wound went away. It started drying up. Oh, it's amazing. It really still amazes me to see some of the miracles that go on as a result of acupuncture.
Carrie Polk is watching. Also, he's a fantastic financial guy. I know he lives down in North Miami. But I want to keep going with what you're saying. I'm a person that likes natural. You know, when we were talking about hemp before, I've had hemp bread. I've been doing hemp seeds. I really, I eat a lot of beets. I eat garlic. I eat a lot of seeds because I know that that's all natural. And so I'm so interested in what you're saying, but I've always been I take magnesium, I take certain things, but I think I don't have one really good vitamin that would probably just catch anything else. So if I came, or if you could send me, that's what I should do, have a bottle. I don't want to go just to a plain store. I want to do what you know because I trust you.
Oh, well, thank you. When you go to a health food store, and the health food industry is a great industry, they serve a big need for the community. However, most of the things that are carried in a health food store fall under what we call the GRASS law. That's an acronym for generally regarded as safe. So the pills that are in those bottles probably don't have what they say they do, but they have to be safe as far as what's in there. And that's the GRASS law. And so most of the vitamin companies manufacture under those laws. When you have pharmaceutical grade nutrition, that means the FDA comes into your facility, they look at your raw materials, they look at your manufacturing process, they look at what your end result is, what your end product is, they analyze it so that what they say is in the bottle has to be in that bottle.
Is that what you have?
Yes, that's what most physicians who carry nutrition have. It's pharmaceutical grade nutrition. Yeah, you pay a little more for it, but you're guaranteed to get what you're looking for, as opposed to, well, we can't guarantee you're getting that, but nothing you're taking is unsafe.
Right. Well, I'm going to order one. I'm telling everyone right now, I'm going to order my bottle. That's really important to me.
I'll bring you one next time I come in.
No, I'm not waiting for next time. Thank you. No, I'm gonna get one from you. Thank you. I know it's important, and I give Charlie a vitamin because it has. I mean, when I read what it has in it, I mean, his food could never produce that. So I'm happy to do that, and I'm happy to know that you know so much about this. I think people ought to come to you when they say, well, I'm taking this and I don't know what to take. Your doctor doesn't know, your typical doctor. And that's okay. He has other things. It's not important enough for him.
Exactly.
But
he's dealing with disease and pathology.
Exactly. And you have studied this because I call you a naturalist. I don't know, is that right?
Well, that's a nice moniker. I appreciate it.
But you do. You do talk about that a lot now that you have your daughter with you too. So I hope that people will call you. Let me give everybody your phone number again. And it's 561-863-8779. Again, 561-863-8779. And the website is allamericanwellness.com. And Dr. Usry does write a very, very good article every month in Boomer Times. Be sure to read it. And if you are suffering from peripheral neuropathy, he specializes in that. And according to what, of course, he tells us, it's very painful. It's very distressing. It changes your life. We don't want you to fall. We want you to have, it's not your shoes. Don't think if you get better shoes, it's going to help you. If you're having migraines, anything that, don't take drugs for it. I mean, you want to take cannabis, that's whatever you want to do. But first get Dr. Usry's opinion about this, because I think that's really important that you do more of a, I would call, a comprehensive look at what their situation is. Is that fair?
Yeah, and frankly, our role in the community is to help people live as long a life as they can, as healthy as they can. And you have to be proactive as you get older if you want to live to 100 and be functional. You need a guy. You need to have someone.
And you're functional.
I'm the guy.
You're the guy. And, I always take his picture because he always comes in here dressed fit to go. I always wonder, where do you go out after this? I mean, I look at his shoes. I look at his stuff. I love men who dress up like this. Do you just go home or you go to your office after this? Is this how you look in your office?
Yeah.
Oh, my goodness.
I dress every day.
That's fantastic because your patients must be, very impressed. I mean,
I don't know that they're impressed.
Yes, they're impressed.
But hopefully they think I dress in a professional manner.
More than professional.
You need to be, I was taught when you're a doctor, you need to be dressed better than your best dressed patient.
I didn't know that. That was a good lesson. Well, Well, Dr. Usry, we did it again. I'm so happy that you came in this morning.
Oh, me too.
And
I just want to say one
Yeah.
thing. I'm gonna on the next article I'm writing. It's how do we get sick? How do we develop cancer? How do we develop
wow.
heart disease?
Okay.
So be on the lookout for it.
Oh, it will be July. It's our big issue anyway. It's coming up. We're going to be at the big expo, a Boomer Expo. So thanks, Dr. Usry.
Oh, my pleasure.
And I think
I love being on your show.
And
Anita.
aren't you going to be at the expo?
I am.
Oh, my gosh, you come and see him. Yay.